For our next talk, I'd like to welcome Marion Henry to the stage. She's a professor of pediatric surgery at the University of Chicago and is going to share with us a story of advocacy and activism, a surgeon's journey, and enlighten us on how that has played out in her experience.
Thank you, Dr. Sutherland. Thank you to the American College of Surgeons and to Dr. Alimi and the Resident and Associate Society for inviting me to share my story today. I have no relevant financial disclosures, and I am honored and humbled to have been invited by RAS to share my journey into surgical advocacy, and I hope that it will give some insights to the more junior members of the audience today and inspire everyone along their own journey in surgery. My professional journey has been all over the map, some might say, but this is not a journey of geography, but a journey of focus on an academic mission. I am a pediatric surgeon and thus took a pretty traditional, straightforward path through medical school and residency. I did research as a medical student, got into a 7-year residency program, did research as a resident, and did a master's of public health, and then got into a clinical fellowship of pediatric surgery. But once I became an attending, the path started to take some turns and winds along the way, and I will discuss some of those pivot points and the mentors who have helped me come to where I am today as a surgical advocate. The beginning of this journey started on a regular December day for me. I dropped my son off at school that morning and went to work. I was lucky. I went home and picked him up from school that afternoon, something the parents of 20 children at Sandy Hook Elementary School could not do that day. For me, this was a wake-up call. And whether that was because I had a child the same age as those children, who was born in the same state as those children, whose elementary teacher was from Newton Elementary, or whether it was just the right time for me to hear the call, that was my wake-up call and my pivot point towards advocacy. There was a problem, though. Where was I in December 2012? I was a year and a half out of fellowship, a young attending, an officer in the Navy. I could not express my personal views in a public forum. My friends and my colleagues all owned firearms, or at least a large majority of them did. I had actually just qualified as an expert shooter on both pistol and rifle as part of my training in preparation for a deployment on an aircraft carrier, and I was trained in the safe handling of firearms. And I was very conflicted. Over the next few years, there were several active shooting events on the base. My children underwent safety drills at school, as many of yours probably did. And the mass casualty events kept coming through the news again and again and again and again, and they still do. Not really knowing what to do at this point, I started to educate myself, and I turned to organizations like the Giffords Law Center and RAND to learn about this problem. And as an individual, a civilian, a mom, I joined organizations like Sandy Hook Promise and Moms Demand Action. And I learned the true facts about the number of victims of firearm violence on a daily basis. And the stories of the daily victims who don't garner the same media attention as all of those mass shooting events. Fast forward a couple years to 2015, when Mary Fallett, who's in the audience, was president of APSA, the American Pediatric Surgical Association had committed to making an impact on the national healthcare agenda as one of its 5 pillars. Dr. Fallett created a new health policy and advocacy committee, And knowing my background with a Master's of Public Health, she asked if I would be the vice chair of this committee. Of course, as I do when pretty much Mary calls about anything, I said yes. But then I had a problem. What is surgical policy and advocacy? I had never heard of the Leadership and Advocacy Summit. I did not know what this was. Although I had completed my Master's of Public Health and I knew a lot about health policy, and I had some ideas about advocacy from my involvement with Moms Demand Action and Sandy Hook, I really didn't understand how that could be done in a professional organization or a professional way. So I turned to educate myself, and I was very fortunate that the American College of Surgeons and the American Academy of Pediatrics both have outstanding educational resources in order to teach you exactly what is advocacy and how you can get involved. And I was also fortunate to have found a couple mentors in Max Langham, who was the chair of the Advocacy and Policy Committee for APSO that I vice chaired, and in Patrick Bailey, who listened to my questions, spent hours on the phone trying to help guide me and really help me along this journey. I was selected by APSA to attend the Brandeis Policy and Leadership course, which also helped guide me as I became more of a leader in this area in our organization. And I look forward to all of you getting to hear John Schlanderian speak later this morning about this leadership course and his leadership endeavors. And I started to realize that the critical elements of advocacy were really not all that different from surgery. How is it done? It's done through education and influence with evidence-based solutions to achieve a desired change. And surgeons have a natural affinity to these areas of both calling and doing that make up both advocacy and activism. I learned the different areas that were important to the American College of Surgeons and the AAP at the time. So I familiarized myself with all of the topics in these areas and the spectrum along which advocacy occurs. And I realized that on a daily basis, we do patient advocacy, fighting for each of our patients for the things they need to get the best care. We might already be involved in local advocacy on hospital committees or local community issues, like getting a stop sign placed where there seemed to be multiple pedestrians struck. And I learned more about advocacy at the state, federal, and global arenas. But I really wondered, why was this news to me? Why was it now, several years out of fellowship, that I was just learning about surgical advocacy? Why didn't I know about this already? I wondered, was it, as Ernest proposed from this 2010 article, that it's just too ambiguous and uncertain, that clinicians are just too clinically busy to do it? Or is it because we're trained not to have personal or political opinions and to keep our conflicting agendas out of our workplace? Or I wondered, was it because it's not part of the traditional tripartite mission of academic medicine and academic surgery in which I grew up, and thus not truly valued in medicine? Yet as a fellow of the American College of Surgeons, we dedicate ourselves to improving the care of the surgical patient through activities including monitoring and analyzing socioeconomic, legislative, and regulatory issues which will affect the field and impact our patients. And as a fellow of the American Academy of Pediatrics, advocacy, education, research, service, and policy should advance all the principles that are priorities in the agenda for children. So as a fellow in both of these organizations, I certainly should be involved in advocacy. And as a student of public health, I knew the saying from Rudolf Virchow that medicine is a social science and politics is nothing else but medicine on a large scale, and that we have the obligation to point out the problems and to attempt their theoretical solution. And I learned that there's a history of advocacy, from Hippocrates to John Snow to Rudolph Virchow, and surgeons such as Mary Edwards Walker, William Halsted, and Ernst Codman. I was very fortunate to find mentors who could guide me, help me find roles in my state chapter of the American College of Surgeons, and help develop me as an advocate at the state level. Lee Newmeyer was the chair at the University of Arizona when I was there, and she helped bring me into the Arizona advocacy realm. Cindy Downard is a pediatric surgeon, and she helped me get involved in advocacy through the American Academy of Pediatrics. Tom Tracy, sitting here, has been a huge mentor in helping my involvement here in the American College of Surgeons, both at state and federal level. Ron Herschel, Vic Garcia, Ed Barksdale, and Jessica Candell have been some of my most supportive, helpful mentors as I've tried to figure out how we take this forward into an organization such as the American Pediatric Surgical Association, and how we build collaborations between APSA and the ACS and the AAP and other organizations. And I learned through doing, through participation in this summit here, through participation in the yearly summit with the American Academy of Pediatrics, through state advocacy days at the Capitol in Arizona, and through participation in a state advocacy committee where we discussed all the local bills, all the bills at the state level that might impact children, and how we should encourage our members to act on those. And as surgical advocacy began to rise and become more prominent in social media, I found a community of surgical advocates, including so many in this room and some of them watching online, who were like-minded surgeons who also had a passion for this field. And we find a professional home at this summit. So in concrete terms, what did that mean that we did for APSA? As I said, APSA had a strategic plan that included impacting the national healthcare agenda of one of its main pillars, and the charge to our committee was to operationalize that. So we began actively fighting for the Children's Health Insurance Program, trying to increase access for medical care for children under expanded Medicaid acts. The Childhood Cancer STAR Act, in order to expand research funding, improve childhood cancer surveillance, and require pediatric expertise at the NIH. We wrote advocacy briefs that brought up items of interest and concern that would be important to pediatric surgeons and encouraged them to take action. We wrote white papers on firearm injuries and their impact on children, on opioid reduction and decreasing prescriptions of opioids in children and in adolescents after surgery. And we partnered with other organizations beyond just the ACS and the AAP, including the Children's Hospital Association and their Speak Now for Kids organization, and First Focus on Children, to educate ourselves and keep at the forefront of those bills that would impact the healthcare of children. And through this work, we're able to continue to focus on some of the main issues for children: injury prevention, child abuse and neglect, firearm injuries, and mental health awareness and research that helps stop that injury cycle. As we did more work in this area of advocacy, it increased our conversations on social determinants of health and on the effects that the neighborhood you live in can have on your healthcare outcomes, on your life expectancy. We started to recognize the healthcare inequalities, and a major important issue now is calling for research funding to help look at the disparities in outcomes in children who undergo pediatric surgical care. Another major pivot point for me was in 2019 at the 50th anniversary of APSA. Ron Herschel was the president of APSA that year, and he invited Adam Foss, a former prosecutor and the CEO now of Prosecutor Impact, to speak about his social justice reform work with pediatric surgeons. I had the fortune of speaking with Mr. Foss, listening to him speak ahead of the conference and speaking to him multiple times before the conference. And then hearing his speech at our conference motivated me and inspired me and really pushed me down this last pivot point to where I am today. Mr. Foss encouraged us all in the room to take the sword and shield that we are given because of our privilege of being a surgeon and use that sword and that shield to do more, to make more of an impact. After that conference, I reflected on what I wanted my impact in pediatric surgery to be. And because of his charge, I changed my backyard view. I left Arizona and moved to Chicago so that I could take on a new academic role. I joined a department that has more of an idea of a quadripartite mission of academia, although they maybe don't know that yet. They support it, they just haven't adopted this very long name for it. As much as we need the basic science researchers to propel us forward in basic science innovation, and as much as we need the outstanding clinicians and clinical care outcomes researchers to improve our clinical care, and as much as we need our ACS master educators working to help us educate the students, the residents, and even to help us keep being educated as professionals in our professional development, we also need this fourth arm of social accountability that we can make happen through our advocacy. This is our contract with society, to be socially responsible and to have social accountability. And we need the surgical advocates who can learn it, understand it, do it regularly and become an expert at it, and teach others to do it, to take forward that fourth arm of an academic mission. I am very fortunate to have been able to find this place that will support blending these two worlds in my career and use my experiences in the one location to inform the other. So my challenge to you today is at the very least to support that quadripartite mission, to support the field of surgical advocacy. It's a pretty easy ask in this audience. But also to acknowledge your expertise, claim your own narrative, and leverage your relationships. Build the collaboratives that we need to build to push these difficult issues forward. Educate and communicate by all available means with those who have the power to make the changes that need to be made. Why surgical advocacy for me? These children cannot fight for themselves. They do not have a voice in our community. We must do that to improve their surgical care, their health care overall, and the health equity that they hopefully will face in their lifetime. I am grateful to so many in this room who might not have appeared in the slides, who have played a role in helping me along this surgical advocacy journey, and I'm happy to take any questions. However, I first would like to take the privilege of the podium for one moment to have everyone wish Dr. Nancy Gant, a mentor of mine, a happy birthday.
Thank you, Dr. Henry. I'm Nancy Gant from Youngstown, Ohio, and I have a question. I did my residency at University of Pittsburgh, but I first was at University of Chicago. I am so happy you are there. And you've got a chair, Jeff Matthews, who will facilitate every one of your magic wishes because Chicago needs you really badly right now. As someone who loves that city so much, I'm devastated every time I see something on the news about those families and the losses they're having. So, what's your big, fat, audacious goal? What are you going to do, especially being on the South Side where things are just crazy? How can we help you?
Thank you for the question, and again, happy birthday. No, I am so fortunate to have found a place with a leader that does support me on this mission. I actually didn't believe it was possible or true when we first started the conversation. The South Side of Chicago is a very challenging place to live, and I live on the South Side of Chicago. There are so many committed individuals and organizations and people from all walks of life in all different fields who are taking on this challenge and hoping to make an impact and make a difference. And what I've done so far and what I still need to continue to do is to network and learn all these different places and people who share the same goal and come at it from different experiences and educations. And that is what I've been working on so far, is building the networks and learning about the different collaboratives and organizations. And I think, my big, bold, audacious goal is to get a large collaborative of physicians, nurses, violence prevention workers, educators, school communities. There's such a cycle of violence that starts, I don't know where the cycle starts or ends, to be honest, because it just keeps going. We see a child who gets shot and their family is ravaged, they're injured or potentially killed. Their whole school community, their church community, their local community has downstream effects. And we have to then put the mental health resources into effect, the social networks into effect, to help people recover from that traumatic incident so that they don't grow up or move on to then cause another trauma. And it can't be done by any one individual or any one organization because it requires so many different aspects. But there's a lack of hope. When we talk to some of our patients, our older teenagers, our young men, there's a lack of hope in the community, and we have to find a way to restore that hope. And we have some medical students who work in some of the high schools in the area. Just working with the high school students to give them skills on how to respond in the immediate action. So they teach them stop the bleed, because these are kids who actually see this traumatic event happen and they don't have the skills to do something, which then re-traumatizes them because they don't know what to do. But it also gives them skills and coping mechanisms in how to process events and talk to each other and talk to other people, and asks their input on what can we do to help rebuild their communities? What can we do to revitalize some of these areas and provide food, jobs, some of those basics which are at the heart of why we have so much crime and trauma.
Thank you.
Thank you.
Good morning.
Good morning.
Thanks, Dr. Henry, as always, for being out front and talking about how important it is for us to have a voice in this conversation. And I wasn't going to say anything today for a variety of reasons. One of which is, I think some of you know, it's been a tough time for us at Hopkins the past 48 hours. One of my partners was shot and nearly killed on Friday morning. And some of you may have had to take care of people that you care about, that you love. And for those that haven't, I hope that you never have to do that. I have a question for you, but I have a comment, as you may not be surprised. And I want to thank Dr. Elsey for recentering the focus that is so critical right now. And a lot of you know, of course, that, I work on gun violence prevention, but I think there's a broader story here. And that broader story is that regardless of what you care about, whether it's immigration, climate change, COVID, health equity, racism, each and every one of us have the opportunity and the responsibility to work beyond the bedside. And not everyone sees that. We are trusted public messengers. Society trusts us. We're part of the fabric of society. And we have the decision that either we can pretend it's not happening, and stand on the sidelines of history, or we can be out front and lead in this effort, regardless of what your issue is. So I would just encourage each and every one of you, the responsibility here is not on the few, it's on all of us. Most governing in America happens at the local and state level. So when people think about what can they do, start in your own community. And I'm so excited that this organization, is being led by another incredible leader, Dr. Turner. I haven't had the chance to publicly thank her. People are not going to be happy. People are going to be pissed about the stuff we say and the stuff we do. And that's okay. We're not going to make everyone happy. But it's our responsibility to be out front of this. And I just want you, Dr. Henry, to tell the people that are coming up through the ranks, what can they do, right? You did an incredible job of telling your story. What can they do to figure out how to carve out their own path and to be part of this process? Thank you.
Thank you, Dr. Saccharin, for those comments. And as you know, all of us, our hearts are with all of you and your partners and your colleagues' family in this really tragic time. If you're coming up through the ranks right now, if you're a medical student or a resident, you're way ahead of where I was. So good for you. And I'm so excited for you to start that journey. And one of the things that I loved doing as part of our state chapter was getting our medical students and our residents to come with us to the Capitol. That's easier in some states than in others, of course. California is a big state. It's hard to bring people from one end to the other sometimes. But I encourage those who are in the junior ranks to try to get involved. Those of you in the more senior positions, get those students and residents involved. Make sure you include them in your groups who are going to these areas. Make sure they are part of your advocacy committees at all levels. Get them involved at the local level. We have a local, I guess its official name is Praxis, and I can't remember what it stands for, but it's a social justice group that is really medical student based and run, and they are involved in advocacy. They're learning how to write op-ed pieces. They're doing research in the community with our trauma patients and our residents on doing trauma care to try to improve that. So find ways, find people within your organization who are doing this. Your media communications people at your hospitals and your medical schools, they are a great resource. They will help you learn to write op-eds or opinion pieces if you don't have something within your own school or a program that does that. They also can connect you to the writers from your various newspapers and news outlets and help you get things published, and they can help guide you. As Dr. Saccharin said, so much happens at the local and the state level that I think is really a very impactful way to start. And I learned so much from the state chapter, actually, of the American Academy of Pediatrics, their advocacy committee in terms of specific things that were relevant to pediatric care, that I was then able to bring over to our pediatric surgeons and help bring that information through. But that state level was really a huge way to get very involved and make an impact. And you have more ability to actually meet with and see people at your state level too. And then of course, come to this event, come to other events like it in order to learn through action itself.
That's all we have time for in the way of questions, but we are getting ready to transition to a break, and I'm sure Dr. Henry would be happy to stay up here for a few minutes and answer any questions.